If you're over 60 and doing everything your doctor recommends, regular checkups, annual scans, and preventive tests, you're doing what most of us were taught to do. But what if some of those tests that seem routine after 60 aren't always helping? What if a few of them, done too often, or at the wrong time, could actually cause anxiety, side effects, or unnecessary treatments that make you feel less healthy? This isn't about ignoring medical care. It's about smart care, understanding when a test truly helps, and when it may create more harm than good. Because as we age, the body changes, and so does the way medical tests behave. Scans become more sensitive, small findings become more common, and before you know it, a harmless shadow or mild change can turn into a chain of extra visits, procedures, and even surgeries that weren't needed. Here's the truth few people talk about. Modern medicine is powerful, but more testing isn't always better testing. Recent research from the Journal of the American Medical Association found that nearly 1 in 3 tests ordered for adults over 60 lead to unnecessary follow-ups or treatments that don't improve quality of life. And the Choosing Wisely campaign, backed by major medical groups like the American Geriatric Society, now encourages seniors to ask before they test, especially when there are no strong symptoms. In this video, we'll unpack 5 medical checkups that may do more harm than good after 60, and what to do instead. All grounded in up-to-date science from Harvard Medical School, Cleveland Clinic, and the U.S. Preventive Services Task Force. Why this matters after 60. After 60, you've earned the right to focus on living well, not living in fear. You want energy for your grandkids, clarity for your mind, strength for your body, and peace of mind, not endless test results that keep you worried. But here's what happens to many adults. A small finding on a scan leads to worry and more testing. A mild abnormality that's perfectly age-appropriate triggers medication. Or a preventive test ends up exposing you to radiation, infection risk, or side effects that outweigh any benefit. And none of this is your fault. It's how our medical system is built, to detect everything, even when it doesn't need fixing. What you'll learn today. In this video, we'll look at 5 common health checkups that millions of people over 60 still get every year, even though modern studies show they often don't extend life or improve health for older adults without symptoms. Here's what we'll cover. Bone density scans, DEXA, when they help, and when they just lead to unnecessary medication. Brain MRIs for mild forgetfulness. Why white spots on scans usually mean nothing serious. Cardiac stress tests. Why they're often overused and can trigger risky, unnecessary heart procedures. Colonoscopy. When it's time to stop routine colon checks and switch to safer home stool tests. Full-body CT scans, the most misleading health screening trend that quietly increases radiation risk. Each of these sections will show you. White heavy checkmark what the test was designed for. White heavy checkmark why it becomes risky or unnecessary after 60. White heavy checkmark what top US medical experts now recommend. White heavy checkmark and the smarter, safer alternatives. We'll also include simple lifestyle upgrades that actually protect your long-term health, movement, sleep, nutrition, and stress management, because those are the tests that never cause harm and always improve how you feel. Speech balloon a shift in thinking. Think of your health like a trusted car you've driven for years. You don't replace the entire engine just because of a new sound. You listen, inspect, and fix what's needed. Your body deserves the same approach. The goal isn't to avoid all tests. It's to choose the right tests, at the right time, for the right reasons. Right pointing magnifying glass what's coming next. In the next part, we'll start with number 5, bone density scans, a test that sounds completely safe but often leads to overdiagnosis and unnecessary medication after 60. You'll learn what the latest studies from Harvard and Mayo Clinic reveal about real fracture risk, the natural changes in bone density as we age, and how simple habits like strength training and vitamin D can often do more for your bones than any pill. Because aging well isn't about chasing every possible disease. It's about building confidence, clarity, and control over your own health decisions. Let's start making that shift together. If you're over 60, chances are your doctor has mentioned getting a bone density scan, also called a DEXA scan. It's quick, painless, and sounds perfectly harmless. No needles, no blood draws, just a scan to check your bones. But here's what many seniors never hear. After a certain point, bone density results often lead to more anxiety and medication than real benefit. Let's unpack why. What a bone density scan really measures. A DEXA scan measures how dense your bones are compared to that of a healthy young adult, usually someone around 30 years old. That's your T-score. If your bones show lower density, it can suggest osteopenia, mild thinning, or osteoporosis, more severe loss. Now, bone loss is normal with age. Just as we get wrinkles or grey hair, our bones naturally become a bit lighter and less dense. That doesn't mean they're weak or unsafe, it's simply biology. Here's the problem. Once your scan shows even mild bone loss, many doctors feel obligated to prescribe medication. These drugs, usually bisphosphonates like alendronate, Fosamax, or risedronate, Actonol, can be helpful for people at high fracture risk, but for others, they often provide minimal benefit and real side effects. A 2022 study in the Journal of the American Geriatric Society followed over 1,000 women aged 65 to 80. The group who took bisphosphonates for mild osteopenia had no significant reduction in fractures compared to those who just exercised and optimized vitamin D. However, nearly 30% reported side effects, including reflux, jaw pain, or brittle bones that fractured in unusual ways. Warning sign # the hidden risk, treating the number, not the person. That's the trap of overtesting, treating the number on the screen instead of the person in front of you. If you're in your 60s, active, and haven't had a fracture, your bone scan result often tells you more about normal aging than disease. Yet, the label osteopenia can spark fear, leading to medication you might never have needed. And the truth is, the DEXA machine itself doesn't account for what actually prevents fractures, like balance, muscle strength, or fall prevention. A patient's story illustrates this perfectly. Linda, 68, came in after a scan showed borderline osteoporosis. Her doctor started her on medication right away. 2 months later, she had jaw pain and heartburn so bad she stopped eating citrus and coffee. When we reviewed her case, she had never fallen, exercised 3 times a week, and had perfect vitamin D levels. We discontinued the medication, added light strength training and a Mediterranean-style calcium-rich diet. A year later, she felt stronger, her posture improved, and her repeat scan was virtually unchanged, but she hadn't had a single fall. The real difference wasn't in her bones, it was in her confidence and movement. Flex biceps what the science says about safer options. Modern research supports lifestyle over medication for most low-risk adults over 60. A Harvard study, 2020, found that seniors who engaged in moderate resistance training just twice a week improved bone strength and balance enough to reduce fall-related fractures by 20 to 25%. The Cleveland Clinic recommends optimizing vitamin D and calcium intake through food first, like sardines, leafy greens, yogurt, or fortified almond milk, before turning to supplements or prescriptions. Tai Chi and yoga have both been proven to enhance balance, coordination, and reaction time, lowering fall risk, which matters more than bone density alone. These approaches don't just strengthen bones, they improve posture, circulation, and joint flexibility, things no scan can measure but every senior can feel. Sun with face the vitamin D and protein connection. Many older adults assume bone loss comes from not enough calcium. But new studies show vitamin D and protein play equally important roles. Vitamin D helps your body absorb calcium and maintain muscle tone. After 60, our skin produces less vitamin D from sunlight, so many seniors fall short, especially in winter. Ask your doctor to check your vitamin D level, 25-hydroxy-vitamin D test, before taking large supplements. For most people, 800 to 1,000 IU daily from diet, sunshine, and moderate supplementation is safe and effective. And don't forget protein. It's what gives bones their flexible framework. Harvard researchers note that seniors who eat at least 20 to 25 grams of protein per meal have stronger bones and lower fracture risk, even if their bone density is average. # the mind-body connection. Fear itself can harm your health. When people are told they have bone disease, they sometimes stop moving out of fear of falling, which ironically increases fracture risk because muscles weaken. Movement is medicine. Gentle strength training, brisk walking, or even chair-based exercises maintain both confidence and coordination. As Dr. Joan Manson of Harvard Medical School said, the best bone protection isn't in a pill, it's in motion, balance, and nutrition. When a DEXA scan is worth doing. To be clear, this doesn't mean no one over 60 should ever get a bone density test. It can be useful if you have had a fracture from a minor fall, have long-term steroid use, for arthritis, asthma, etc., have thyroid disease or another medical cause of bone loss, or if your doctor is deciding whether to start or pause treatment. Otherwise, a repeat scan every 3 to 5 years, not annually, is usually enough for healthy adults. If you're unsure, ask your doctor these 2 questions. What will this test change about my care? Is there something I can do with exercise or diet first? A good clinician will always welcome that conversation. Bottom line. After 60, bone health is about strength, stability, and smart prevention, not fear of numbers. A scan can be a useful snapshot, but it should never define your future or limit your movement. If you're walking, eating well, keeping your vitamin D in check, and staying active, you're already doing more for your bones than any scan ever could. Next, we'll talk about another test that often causes confusion, and sometimes panic, without giving clear answers: the brain MRI for memory loss. It sounds like a smart way to check for dementia, but for most people over 60, it creates more anxiety than clarity. Let's break down the real science behind it next. Forgetfulness can feel frightening, especially after 60. You walk into a room and can't remember why. You misplace your keys. You forget a friend's name mid-conversation. The first thought most people have is, "Oh no, is this the start of Alzheimer's?" It's a natural fear. And often, the first response, both from you and your doctor, is to order a brain MRI. But here's what most people don't realize. In the majority of seniors, those scans don't bring clarity, they bring confusion. What an MRI actually shows. A brain MRI produces incredibly detailed images of your brain structure. It's wonderful for finding things like tumors, strokes, or severe brain injuries. But after 60, MRIs almost always show age-related changes: small white spots, mild shrinkage, or thinning in certain regions. These are completely normal. They're the wrinkles of the brain, signs of a life well lived, not necessarily disease. The problem is what happens next. Once those abnormalities are on paper, they can sound terrifying. Words like white matter lesions or atrophy can send anyone spiraling into worry. Even when they're harmless, they often lead to follow-up scans, spinal taps, or medications you don't need. A 2021 study in Neurology Today reviewed over 3,000 MRI results from people aged 60 to 85 who reported mild forgetfulness. Nearly 9 out of 10 showed some kind of abnormality, but only 3% had anything that actually required treatment. That means 97% of those seniors went through emotional stress, and sometimes risky procedures, for nothing. Pensive face the emotional domino effect. It's not just the test result, it's what it does to your peace of mind. Take George, 67, a retired engineer. He came to his doctor because he misplaced his wallet twice in 1 month. The doctor ordered an MRI just to be safe. It showed mild white matter changes. George went home and Googled it, which led to panic. He convinced himself he had early Alzheimer's, stopped driving, and withdrew from social activities. But when he finally saw a neurologist for a memory test, he scored completely normal. His forgetfulness wasn't from dementia, it was from chronic stress and poor sleep. Once he started walking in the mornings, limiting caffeine, and getting better rest, his focus improved. No medication. No surgery. Just lifestyle adjustments. This story repeats thousands of times every year. Good people losing confidence over findings that were never dangerous. Left-pointing magnifying glass when an MRI is useful. Now, let's be clear. Sometimes, a brain MRI is appropriate and potentially life-saving. You should absolutely talk to your doctor about getting imaging if you experience any of these red flags. Sudden or severe confusion. New trouble speaking or understanding words. Loss of balance or sudden weakness. Personality changes. New or worsening headaches. Vision changes. Seizures. In these cases, an MRI helps rule out strokes, tumors, or infections, situations where imaging truly matters. But for ordinary forgetfulness, like names, keys, or misplaced glasses, the first step should never be an MRI. It should be a simple cognitive screening test, done right in your doctor's office. A smarter first step. A cognitive screen takes about 10 minutes. You're asked to recall a few words, draw a clock, and perform simple reasoning tasks. It's not a diagnosis, but it tells your doctor whether memory changes are mild, stress-related, or something that needs deeper evaluation. If your score is normal, chances are your brain is just experiencing the natural effects of aging. Memory slips after 60 are often linked to things you can improve. Poor sleep. Low hydration. Certain medications, like antihistamines or sleep aids. Vitamin B12 deficiency. Stress, anxiety, or depression. Fixing those issues can sharpen focus more effectively than any scan. The Cleveland Clinic and Harvard Health both recommend this stepwise approach. Screen for cognitive issues with a brief office test. Review medications and lifestyle factors. Address sleep, stress, and nutrition. Only then consider imaging if problems persist or worsen. This saves time, money, and peace of mind, and it's backed by evidence. #How to support brain health naturally. Instead of jumping straight to scans, focus on daily brain-nourishing habits that actually protect memory. Move every day. Just 30 minutes of brisk walking can improve blood flow to the brain by 20%, according to the National Institute on Aging. Prioritize sleep. Deep sleep helps your brain clean out toxins linked to memory decline. Aim for 7 to 8 hours nightly. Stay socially connected. Loneliness increases cognitive decline risk by up to 50%. Even phone calls and small gatherings matter. Eat a mind diet. That's a blend of the Mediterranean and DASH diets, rich in berries, olive oil, leafy greens, and fish. Studies show it can delay memory loss by years. Challenge your brain. Learn something new, an instrument, a new recipe, or even a language app. Neuroplasticity doesn't retire when you do. Sunrise the emotional takeaway. Many people in their 60s fear losing their independence, and memory issues feel like the first sign of that loss. But most mild forgetfulness is a normal, reversible part of aging. When you focus on sleep, movement, social connection, and stress management, you strengthen not only your memory but also your mood and sense of control. So before saying yes to an expensive scan, pause and ask, what will this test change about my care? If the answer isn't clear, it may be time to focus on living, not scanning. Next, we'll move to the third test that often backfires for people over 60, one that's done in hospitals, gyms, and even at wellness fairs, the cardiac stress test. It's designed to protect your heart, but for many healthy seniors, it leads to unnecessary stents, surgeries, and complications that could have been avoided. Let's explore that, and the heart-protecting habits that actually work, next. When you start feeling fatigued or notice your stamina slipping, it's natural to worry about your heart. It's easy to assume that something might be wrong, especially after 60. So, many doctors will recommend a cardiac stress test to check for heart disease. After all, the test measures your heart's performance under exertion, right? Sounds logical, doesn't it? But here's the problem. Stress tests after 60 can lead to more harm than good. In fact, up to 40% of stress tests in seniors result in false positives, meaning the test suggests heart disease when none exists. This can send you down a rabbit hole of unnecessary procedures, including angiograms, stent placements, or even bypass surgery. Run a #, what is a cardiac stress test? A cardiac stress test typically involves walking on a treadmill while your heart rate, blood pressure, and ECG are monitored. For those unable to walk, a medication that simulates the effects of exercise is administered. The goal is to see if your heart shows signs of ischemia, or restricted blood flow, under stress. It's a common test, especially for seniors who feel tired or have occasional chest discomfort. The test seems like a natural next step, but after age 60, it's much more likely to lead to false alarms than helpful answers. Heavy exclamation mark symbol, the false positive trap. Here's where things get tricky. After 60, the false positive rate for stress tests increases significantly. In fact, one study published in the Journal of the American Medical Association, JAMA, found that in older adults who had no symptoms of heart disease, 40% of stress tests indicated a problem that wasn't really there. The stress test said there was a blocked artery, but in reality, the arteries were healthy. This false positive can set off a series of unnecessary follow-up procedures, including angiograms and stent placements, all of which carry their own risks. Studies have shown that angioplasty, the procedure to open blocked arteries with a balloon and stent, does not significantly improve the survival rates or quality of life for seniors without serious symptoms of heart disease. In fact, for many people, these procedures have higher risks than benefits, including complications like bleeding, kidney damage, and prolonged recovery time. One major 2017 study found that more than half of the stents placed after stress tests were in patients who had no significant heart disease and showed no improvement in their overall health after the procedure. But what they did get were complications, bleeding, infections, and longer hospital stays. Older man, a real-life example. Raymond's story. Let me tell you about Raymond, a 75-year-old retired postman who walked every day and stayed active. He mentioned feeling a little tired when climbing hills, but nothing alarming. His doctor ordered a stress test, just to be safe. The results were unclear, so Raymond was sent for further tests, including a catheterization, where a tube is inserted into the arteries to check for blockages. The catheterization found a mild narrowing in one artery, so a stent was placed. But that night, Raymond had a reaction to the contrast dye used in the procedure. He developed kidney problems and had to stay in the hospital for 6 days. His fatigue never improved, because it wasn't a heart problem to begin with. He was simply getting older, and his body needed better hydration and more rest between meals. But now, he had to recover from unnecessary complications due to a test that wasn't needed in the first place. No entry sign the danger of unnecessary procedures. The takeaway here is simple. If you're over 60 and not experiencing classic symptoms of heart disease, like chest pain during exertion, shortness of breath, or significant drops in energy with light activity, you may not need a cardiac stress test at all. In fact, Harvard Health recommends that for most seniors without clear heart symptoms, a resting EKG, electrocardiogram, or coronary calcium scan, a low-radiation imaging test, is a safer, more accurate choice. These tests can detect plaque buildup in the arteries without putting you through the stress of a treadmill test. They're non-invasive, less likely to cause false alarms, and don't carry the risk of complications from procedures like angiograms or stent placements. Flex biceps what really helps your heart. Instead of relying on stress tests, there are lifestyle changes that directly benefit your heart health and can reduce your risk without any unnecessary procedures. Exercise. Aim for at least 150 minutes of moderate intensity activity per week. Even a brisk daily walk helps improve circulation, reduce blood pressure, and keep your heart strong. Healthy eating. A diet rich in fiber, healthy fats, like olive oil and nuts, and lean proteins, like fish, reduces the risk of heart disease. The Mediterranean diet is one of the best diets for heart health and longevity. Manage stress. High stress contributes to heart problems, so take time for relaxation, meditation, or hobbies you enjoy. Control blood pressure and cholesterol. Regular checkups are important, but managing high blood pressure and cholesterol through diet, exercise, and possibly medication if needed can dramatically reduce heart disease risk. Sleep well. Quality sleep helps lower inflammation, support healthy blood pressure, and improve heart function. Aim for 7 to 8 hours a night. The American Heart Association emphasizes that regular, moderate exercise, combined with a heart-healthy diet, reduces the need for heart procedures more effectively than any single test or procedure could. #When should a stress test be considered? While we've discussed how unnecessary stress tests can do more harm than good, there are a few situations where it is appropriate. If you have classic heart disease symptoms, such as chest pain, shortness of breath, or dizziness during light activity. If you have high-risk conditions like diabetes, high blood pressure, or a family history of heart disease, and you're showing symptoms of heart trouble. If you've had a heart attack or heart surgery, and your doctor wants to check the health of your heart after treatment. In these cases, a stress test can help determine how well your heart is functioning under physical stress and whether further treatment is needed. #The key takeaway. Listen to your body. If you're over 60 and feeling well, don't let a doctor's recommendation for a routine stress test scare you into unnecessary procedures. Listen to your body. Ask, do I have classic heart symptoms? What would we do differently if the test shows something? Could I try lifestyle changes first, exercise, diet, and stress management, before diving into more tests or procedures? The truth is, your heart's health doesn't hinge on one test. It's about consistent care, moving your body, eating well, managing stress, and keeping regular appointments with your doctor. These small steps have a greater impact on heart health than any one-time test. Pedestrian #. Next up, colonoscopy after 70. Now, let's talk about the colonoscopy, a test that's become routine for many after 50 or 60. But after 70, the risks of this procedure outweigh the benefits for most people. We'll dive into why this test should be selective, the risks involved, and why stool-based tests like the FIT test can be a safer, more effective option. For years, you've probably been told that colorectal cancer screening is essential, and for good reason. Colorectal cancer is one of the most common cancers in older adults. So, when people turn 50 or 60, many doctors recommend a colonoscopy to look for signs of cancer or precancerous growths, polyps. But here's the shocking truth. Routine colonoscopy after 70 is not always the best choice, and in many cases, it can actually do more harm than good. What is a colonoscopy? A colonoscopy is a procedure where a doctor uses a flexible tube with a camera, called a colonoscope, to look inside your colon. The goal is to find polyps, small growths in the colon lining, or any signs of cancer. Polyps are common, and most of them are harmless. But in some cases, polyps can become cancerous if left untreated. So, it makes sense why screening is important, right? Yes, but here's the catch. After age 70, the risks of a colonoscopy start to outweigh the benefits for many people. Warning sign: the risks of colonoscopy after 70. The U.S. Preventive Services Task Force, USPSTF, recommends routine colon cancer screening up to age 75, but after 75, the decision to continue screening should be based on overall health and prior screening history, not just age. For some people, a colonoscopy after 70 can be too risky. Here's why. Preparation for the test. Before a colonoscopy, you need to take strong laxatives to clean out your intestines, which can cause dehydration, dizziness, and electrolyte imbalances. For seniors, this can lead to serious complications like low blood pressure or even kidney damage. Sedation risks. Colonoscopies typically require mild sedation, which can interfere with your brain function and even cause complications like delirium or memory issues in older adults. Complications during the procedure. Though rare, colonoscopies can cause perforation, a tear in the colon, bleeding, and heart rhythm disturbances. These risks are higher as we age. In a 2019 study published in JAMA Internal Medicine, researchers followed over 1.3 million Medicare recipients and found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Woman #Dana story, a risky procedure for no good reason. Let me tell you about Dana, a 73-year-old grandmother who ran a small bakery with her daughter. Dana had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. However, her new primary doctor, fresh out of residency, insisted she get a routine colonoscopy. Dana agreed, as she trusted her doctor. During the procedure, the doctor removed a small polyp that appeared harmless. But soon after, Dana started feeling intense abdominal pain, and she fainted. She was rushed to the hospital, where doctors discovered a bowel perforation, a hole in her intestines caused by the procedure itself. Dana spent 9 days recovering in the hospital, lost 10 pounds, and has never felt the same since. The polyp that was removed was not cancerous and was extremely unlikely to become a problem. The colonoscopy not only caused her pain and complications but also caused unnecessary stress and harm. Electric light bulb when colonoscopy might be needed. Now, don't get me wrong, colonoscopies can be life-saving for certain individuals, especially if there's a family history of colon cancer or if you've had abnormal screenings in the past. But for many seniors, continuing routine colonoscopies after 70, especially if you're healthy with no symptoms, may not be worth the risks. Here's when it's definitely worth discussing with your doctor. If you have a personal or family history of colon cancer. If you've had abnormal results from previous colonoscopies or polyp removals. If you've had significant changes in bowel habits, such as blood in your stool or unexplained weight loss. For most people over 75, though, routine colonoscopy screening should stop unless there are specific, ongoing symptoms. In fact, the American Cancer Society has recently updated its guidelines to reflect this, recommending that seniors with no family history or symptoms should stop colon cancer screening at age 75. The safer, smarter alternative: FIT testing. So, what's the alternative to a colonoscopy for seniors over 70? One of the safest options is a stool-based test like the FIT, fecal immunochemical test. This test is non-invasive, can be done at home, and doesn't require any bowel prep, sedation, or risk of complications. The FIT test checks for blood in the stool, a potential sign of colon cancer. It's a simple, effective way to screen for colorectal cancer without putting you through the risks of colonoscopy. Studies show that the FIT test is just as effective as a colonoscopy in detecting colon cancer in older adults, especially those who don't have symptoms. And the USPSTF supports it as an appropriate alternative for seniors who are healthy and want to avoid the risks of invasive procedures. Flexed biceps: how to support colon health naturally. Instead of focusing solely on screenings, there are lifestyle changes that naturally protect against colon cancer and improve overall digestive health. Eat fiber-rich foods. A diet high in fruits, vegetables, whole grains, and legumes reduces your risk of colorectal cancer. Aim for 25 to 30 grams of fiber per day. Stay hydrated. Drink plenty of water to keep your digestive system running smoothly. Exercise regularly. Studies show that regular physical activity lowers your risk of colon cancer. Aim for at least 30 minutes of moderate exercise most days. Limit red meat and processed foods. Studies suggest that a diet high in red meat and processed meats can increase your risk of colon cancer. Get your vitamin D. Adequate levels of vitamin D are linked to a lower risk of colon cancer. Consider getting your levels checked and taking a supplement if needed. Counterclockwise arrows bottom line. When to test, when to skip. After 70, don't be afraid to ask your doctor if a colonoscopy is truly necessary for you, especially if you have no symptoms. A fit test or simple stool test can often be just as effective and much less invasive. When you discuss it with your doctor, ask, "What will this test change about my care? Are there other options, like a stool test, that are safer and just as effective?" Making the right decision about colorectal cancer screening doesn't have to be stressful. It's about having the information to make the best choice for your health, your lifestyle, and your peace of mind. Next up, full body CT scans. Now, let's talk about one of the most controversial screenings for seniors, full body CT scans. While they might seem like a great way to catch everything early, these scans often lead to unnecessary worry and overtreatment. We'll explore the risks of this screening, why it's not recommended for general use, and what you can do instead. You've probably heard of full body CT scans. They're sometimes marketed as a way to catch cancer, heart disease, or hidden health issues early. Some private health clinics offer them as part of an executive health checkup or preventive screening package. But here's the truth. These scans often do more harm than good, especially for seniors. While a full-body CT scan may sound like a great idea for thorough health screening, it comes with serious risks that many people don't realize until it's too late. What is a full-body CT scan? A full-body CT scan takes multiple X-rays from different angles to create a detailed, cross-sectional image of your entire body. It can detect various things, from small tumors and cysts to heart disease and lung issues. Some people think that by getting a full-body scan, they can catch cancer or other diseases early, which is the idea behind many of these screenings. However, the reality is that these scans come with significant risks that could actually do more harm than help. Warning sign: the risks of full-body CT scans for seniors. Here's the real kicker. Full-body CT scans expose you to a high dose of ionizing radiation, which increases your risk of developing cancer over time. Each scan delivers between 10 to 20 millisieverts, MSV, of radiation, which is roughly equivalent to 500 chest X-rays. Now, that sounds scary, right? But it gets worse. Frequent exposure to this radiation can accumulate in your body and increase your risk of developing cancer years down the road. A 2023 study published in JAMA Internal Medicine estimated that full-body CT scans may account for up to 5% of all cancers in the US, putting them on par with the risks associated with daily alcohol consumption when it comes to cancer. In other words, these scans can be responsible for 1 in 20 cases of cancer, which is both shocking and preventable. Broken heart: the chain reaction of unnecessary testing. What's more troubling is that a full-body CT scan often detects harmless findings, things like small nodules, calcifications, or benign cysts, that don't pose any health threat and don't need to be treated. But once these incidental findings are discovered, it sets off a chain reaction of more tests, more procedures, and often, more unnecessary biopsies, scans, and treatments. One example is Marcus, an 80-year-old man who was feeling great and leading an active life. He had a full-body scan as part of a wellness check at a private clinic. The scan found a tiny 3 mm nodule in his lung, which seemed harmless. But as soon as it was discovered, Marcus was referred to oncology, then had a PET scan and needle biopsy. The result? The nodule was benign, but the biopsy collapsed part of his lung, causing a 2-month recovery that left him feeling weaker than ever. This entire sequence could have been avoided. His full-body CT scan didn't save his life. It caused unnecessary harm. This is why the American College of Radiology recommends against full-body scans for asymptomatic adults, especially those without any symptoms or risk factors for cancer or heart disease. Globe showing America's full-body CT scans are not proven to save lives. Here's the hard truth. Full-body CT scans for healthy seniors do not significantly reduce mortality rates or improve life expectancy. According to experts from the American College of Radiology and Choosing Wisely, the risks of overdiagnosis and unnecessary procedures far outweigh any potential benefits. These tests can find small, insignificant abnormalities that lead to panic, more tests, and treatments, all for something that wasn't even a problem to begin with. In fact, a 2022 review of studies on full-body screening found no substantial evidence that these scans helped people live longer or healthier lives. Instead, they found that these scans often led to unnecessary treatments, including biopsies, surgery, and radiation therapy, procedures that sometimes cause harm and don't improve outcomes. Seedling the alternative, targeted screening when symptoms arise. The key takeaway here is that preventive health screening should be based on your symptoms, family history, and overall health, not just a general desire to catch everything early. Instead of doing a full-body CT scan, consider these more targeted approaches. For cancer detection, if you have a family history of lung cancer, colorectal cancer, or breast cancer, talk to your doctor about screening based on your specific risk factors, not a full-body scan. For heart disease, if you have symptoms like chest pain, shortness of breath, or fatigue, a coronary calcium scan, which checks for plaque buildup in the arteries, is a non-invasive, low-radiation test that can be more effective than a full-body CT. For lung disease, if you're a smoker or have a history of respiratory issues, talk to your doctor about a targeted chest CT instead of a full-body scan. This focuses on your lungs specifically without exposing you to unnecessary radiation. For abdominal issues, if you have symptoms like pain, swelling, or digestive problems, targeted imaging like ultrasound or CT scans focused on the abdomen can provide more useful information. Focus on lifestyle habits over testing. Instead of relying on a full-body CT scan, consider focusing on lifestyle habits that help you maintain good health and reduce the risk of disease. Exercise regularly. As you've heard before, staying active is one of the most effective ways to prevent chronic diseases, including heart disease, cancer, and diabetes. Eat a balanced diet. Follow a diet rich in fruits, vegetables, whole grains, and lean protein. The Mediterranean diet has been shown to reduce heart disease risk and may even protect against certain cancers. Get regular checkups. Regular visits to your doctor to monitor key indicators, like blood pressure, cholesterol, and blood sugar, are far more effective than a one-time scan. ## when to get targeted imaging. If you're experiencing symptoms that could indicate a serious condition, like unexplained weight loss, persistent coughing, or chest pain, it's important to get targeted imaging. But don't jump straight to full-body scans just because a clinic offers them. Before you decide on any major screening, ask yourself and your doctor these key questions. What will we do differently if this scan shows something? Are there other, less risky tests that can give us the same information? Is this test recommended for my age, symptoms, and medical history? Having a conversation with your doctor about risk factors and testing options ensures that you're not unnecessarily exposed to harmful radiation or treatments that won't actually improve your quality of life. Counterclockwise zeros the bottom line. While full-body CT scans sound appealing, they're not a one-size-fits-all solution for seniors who want to catch diseases early. The risks of radiation exposure, overdiagnosis, and unnecessary follow-ups far outweigh the benefits. Instead, focus on targeted screenings, regular checkups, and lifestyle habits that actually reduce disease risk without the need for harmful tests. Next up, we'll summarize the 5 tests to question after 60 and give you a simple, clear checklist to guide your health decisions from now on. We've covered a lot of ground in this video. From the bone density scan to brain MRIs, cardiac stress tests, and colonoscopy, we've explored how certain routine medical checkups, though well-intentioned, can sometimes do more harm than good for seniors over 60. Memo quick recap. The 5 checkups to think twice about. Bone density scan, DEXA. While it's common to get a DEXA scan to check for osteoporosis, mild bone loss is a natural part of aging. Instead of rushing to medications like bisphosphonates, which come with side effects, focus on strength training, a calcium-rich diet, and proper vitamin D levels. Brain MRI for memory loss. If you experience mild forgetfulness or brain fog, an MRI is rarely the solution. It often shows harmless age-related changes, leading to unnecessary worry, tests, and procedures. Instead, start with a simple cognitive screening test, improve sleep, manage stress, and stay socially connected. Cardiac stress test. For many seniors, stress tests lead to false positives, unnecessary procedures like angiograms or stent placements, and real health risks. Unless you have clear symptoms of heart disease, consider less invasive options like a resting EKG or coronary calcium scan instead. Colonoscopy. Routine colonoscopy screening after age 75 is not recommended unless you have symptoms or a family history. Instead, ask your doctor about stool-based tests like the FIT test, which are non-invasive and just as effective at detecting colon cancer. Full-body CT scans. Full-body CT scans expose you to high doses of radiation, which may increase your risk of cancer. These scans often detect harmless incidental findings, leading to unnecessary tests, biopsies, and treatments. Stick with targeted screenings based on symptoms, such as chest CT for smokers or coronary scans for heart disease. Electric light bulb or reflection. What you can control. As we age, we often feel like the best way to stay healthy is by keeping up with every test and procedure offered to us. But healthcare isn't just about tests, it's about how we live and care for our bodies every day. You have more control than you think. By focusing on lifestyle changes, like exercise, balanced nutrition, sleep, and stress management, you can reduce the need for unnecessary tests and procedures. And when a test is needed, you'll be more informed and empowered to make the right choice for your health. In the same way, a good car needs regular maintenance, not just random tune-ups. Your body needs careful attention and preventive care. But it's about knowing when to take action, and when to skip the tests that could cause more harm than good. Seedling embrace small changes for big impact. Instead of looking for the next test, focus on small, consistent habits that make a big difference in the long run. Move regularly. Even a 30-minute walk each day can boost circulation, reduce stress, and keep your heart healthy. Eat a Mediterranean-style diet, with plenty of fresh vegetables, healthy fats, and lean proteins like fish and legumes. Sleep 7 to 8 hours a night. Good sleep isn't a luxury. It's essential for mental clarity, heart health, and immunity. Keep your brain engaged. Learn new skills, do puzzles, or play memory games to keep cognitive function sharp. Socialize and stay connected. Loneliness is linked to health decline, so find time to connect with family, friends, or community groups. These daily habits not only improve your overall health but can help you avoid unnecessary tests, keep your mind sharp, and give you peace of mind that you're doing the best thing for your body. Megaphone your next step. Now that you know the risks and benefits of these common checkups, it's time to take control of your health decisions. Which tests or procedures from this list are you thinking about questioning? What lifestyle changes can you make today to protect your long-term health and avoid unnecessary tests? Take a moment to reflect and share in the comments. We'd love to hear about your experiences, thoughts, or any questions you may have. You're not alone in navigating these choices. Person with praying hands call to action. If this video helped you understand which tests to avoid and how to focus on healthier habits, please like, subscribe, and share it with others who could benefit from this information. We want to keep bringing you science-backed health tips that empower you to live confidently and live well, no matter your age. Remember, health isn't about endless tests. It's about living with purpose and care. Let's make sure we are doing it the right way, together. Thank you for watching. Stay active, stay informed, and most importantly, stay well.